Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and this is Juju, my 17-month-old French bulldog who is learning how to be a very good office dog, and she's doing great. She's really coming along nicely. So today we're going to talk about EMFs, electromotive forces, and EMFs are becoming more and more prominent as a health concern because there is a subset of people who are extremely sensitive to EMF. You know, EMF is what is emitted from cell towers, from all kinds of different electronic gadgets, your phone, and there's there's a growing number of people that are extremely sensitive to EMF, and it makes them very, very sick. I mean, so sick that I have patients that can't live in their house. They have to live in a yurt in the country. And I'm not kidding you. That's how serious that is. They have to get completely away from all of the EMFs. And I have another patient whose husband built her a Faraday cage, and she has to live in a Faraday cage because she's so EMF sensitive. The point is that for those of you who have known me, I basically practice environmental medicine. All of the things that I treat, like tick-borne illness, like mycotoxins, like COVID, like EMF, they are all environmental insults. They come from the environment and they affect our health. And EMFs is no different. In fact, there's a very famous scientist named Martin Blank, and you can look for him on YouTube, Martin Blank, and he talks about the dangers of um, chronic EMF exposure at the cellular level. And he's really interesting. He's really smart. I think he's a physicist. And so, for those of you that are concerned about EMFs in your house, you can get an EMF evaluation. That's what I did. And a guy will come out to your house and take meter readings all over your house and tell you what your EMF ratios are. And then you can see if you need to move your router or whatever. But basically, your router needs to be on the opposite side of the house from where you sleep. It should not be near you. Really, it should not be near you. Um, the other thing that's really interesting about EMFs is that they cause red blood cell clumping, aggregation of red blood cells. So, the stickiness, red blood cells are sticky. The stickiness they stick together in the presence of EMF. The last thing that happens is that when EMFs are um, when a person that has mold is around EMFs, the EMFs cause an increase in the production of mycotoxins by the molds inside their body and makes them even sicker. So EMF and mold, they do not vibe at all. So you want to, if you're having EMF sensitivity, the first thing you want to check for is there mold in your environment. There is also a genetic component to it as well that has to do with calcium voltage gated ion channels, and um, there is that's not the only gene that's involved, but that's what we know right now. So EMF sensitivity appears to be somewhat environmentally induced as well as a genetic predisposition. So symptoms of EMF exposure are things like severe headache, numbness and tingling, lethargy, fatigue, anxiety, um, and muscle aches. And it could be a myriad of a number of different things, but that generally is the symptoms of EMF sensitivity. Right, Juge? We have to be careful for our animals too. Our animals are also very sensitive to EMFs, and maybe even more so than we are, because they're just more in tune with the energy of the universe. Um, Maybe juju isn't, but you know what I mean. So, anyways, I just wanted to give that brief little bit on EMF illness. I do see it, and it's almost always related to mold, almost always. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.